Well, exercise certainly is an important part of being healthy, but for many people, a workout takes their breath away. Our Health Beat anchor Anne-Marie Tiernan joins us now. She's got more on the Health Beat. Hi, Ann.
Well, hey there, Scott. It is exercise-induced asthma, a condition that Dr. Steve Samuels says is underdiagnosed. Dr. Samuels with Franciscan Alliance joins us live in studio today. Thanks so much for joining us.
Thanks for having me.
I understand it's a really busy season right now for sports physicals, and you're seeing this present in your office all the time.
Absolutely. It is underdiagnosed, and it's a nice thing about it. Having some of the symptoms that are associated with exercise-induced asthma.
What is exercise-induced asthma?
It's a variant of asthma that these children don't have asthma continuously around the clock, year in, year out, but with exercise they can go into very similar symptoms like we see in typical asthma patients.
Okay, so what are some of the symptoms then that parents and students should be looking out for?
Coughing, shortness of breath, inability to compete in activities maybe like they were able to when they were younger, or just avoidance of the activities because of the shortness of breath.
And this is something that comes on with the activity.
Absolutely. This is normal day-to-day life, basic function. They don't feel it. When they suddenly try to exert themselves, they're not able to access their full lung capacity.
So they have this tightness in the chest, and one of the things that if during the exam that it comes out that maybe there's been a history of this, something that you might order, I understand, is a pulmonary function test.
Absolutely. The pulmonary functions help us measure whether the patient truly has asthma or not. In this, we're going to want to measure how their asthma occurs after activity.
Okay, so when you mentioned that, I thought, what is this kind of test? We went down to your office to check it out. Let's look right now at someone who's getting this exam.
Big breath in, and blow hard. Blow, 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 blow.
Okay, so what's going on here, Dr.
What
Samuels?
we're trying to measure is how quickly you can access your lung function. Asthma patients typically have total normal lung capacity, but they can't access it rapidly. So we have somebody blow out very, very fast and see how much over 1 second they can blow out. When that's low, it helps us diagnose asthma. And then you're seeing the person exercise and repeat the test to see if we can induce the asthma episode right there in the pulmonary function lab.
And if there is a decline in pulmonary function after that baseline, there are medicines that are available.
Absolutely. Sometimes a simple rescue inhaler like you've seen people use, an albuterol inhaler, can be very effective. The timing of that is very important. You can't use the inhaler right when you exercise. You need to use it at least an hour ahead of time to get the maximal benefit. If you have severe exercise-induced asthma, a maintenance medication that includes a steroid inhaler may be beneficial, as well as a drug called Singular, a pill, can be very beneficial.
Okay, very timely, good information, and we have more information on our website at WTHR.com if you think that this might be a fit for you, and also where perhaps you could get this pulmonary function test. Back to you, Scott.
All right, Ann.